Welcome and thank you for joining us for today's session, School Adolescent Health. How do schools affect adolescent physical and mental health, and what can schools do to strengthen students' overall health? This presentation explores answers to those questions and more. We will focus on the relationship of adolescent physical and mental health, health behaviors, and how school policies and environments influence adolescent health outcomes, including those related to HIV, sexually transmitted disease, and unintended pregnancy. Before we begin, we want to remind you that the information provided in this training is for informational purposes only and does not constitute legal advice. Change Lab Solutions does not enter into attorney-client relationships. Please be aware that this training discusses difficult topics such as racism, homophobia, sexual abuse, and suicide. We encourage participants to take breaks or whatever they need to feel safe and supported throughout this training. First, we acknowledge the challenges and difficulties schools are under in a post-COVID environment and thank them for the incredible work they're doing. This presentation is geared towards those involved in school environments, local decision makers, community leaders, parents, caregivers, educators, and other school staff. The concepts discussed today can help school leaders better understand the factors that contribute to adolescent health outcomes, to develop and implement future strategies and policies that foster a safe and supportive school environment, thus improving the academic and personal experiences of adolescents. This presentation explores the following questions. What factors affect adolescents' social, emotional, and physical outcomes? What role do schools play in promoting adolescent health? What effect do school policies have on adolescent health and well-being? How can schools better support adolescents' physical and mental health and well-being? Note, throughout this presentation, we talk about the experiences of students who identify as lesbian, gay, bisexual, transgender, or questioning, LGBTQ+, and the importance of policies that support this community of students. When we use other terms such as LGBTQ, it is to be accurate about data in studies we reference. To get started, let's do some grounding and discuss some of the factors that affect adolescents' social, emotional, and physical outcomes. When we discuss factors that contribute to adolescent health, it's important to look beyond individual choice and discuss the role of environmental factors in adolescent health. Adolescent behavior is influenced at many levels, which we discuss throughout the presentation. However, to have the most positive impact on adolescent health, schools, government agencies, community organizations, and community members must work together collaboratively to ensure adolescents have the tools to make healthy choices. A multidisciplinary approach by schools to improve adolescent health outcomes considers factors that contribute to the cognitive, social, physical, and emotional developments of adolescents. Now let's look at the factors that contribute to common health risk behaviors of adolescents. It's important to contextualize these factors as many health behaviors are influenced by elements that are beyond an individual's locus of control. They include modeled behavior in decision-making and stressors experienced in the household by parents, family, or guardians. Despite a shift away from parents and toward peer groups in adolescence, parents continue to play an important role in the risk-taking and associated behaviors of adolescents. As children begin to transition into adolescence, peer involvement and influence largely increase. Influence among peers includes sharing about social norms, conflict, increased risk-taking, and other social skills. Then, we have school influences. Given the large amount of time adolescents are in school, school environments are highly influential to adolescent health behaviors. Examples of school influences include feelings of school connectedness, a safe school environment and climate, and supportive staff and faculty. We'll talk about this a bit further along in the presentation. After school influences, there are community influences, which includes any communities adolescents identify or interact with. Mainly, this refers to the structural and social characteristics of neighborhoods or communities, such as neighborhood resources, community organizations, and socioeconomic demographics. Finally, there are societal influences. This refers to structural and social characteristics, such as laws and policies that shape societal expectations, outcomes, opportunities, and resources. Although policies aren't explicitly listed in this model, it's important to consider how policies, especially those at the school, community, and societal levels, have profound impacts on youth behavior. We look at some of those later in today's presentation. Research shows us that health behaviors are a result of social and environmental factors. With this in mind, the CDC developed the What Works in Schools WWIS, a school-based prevention program that has been shown to improve health behaviors and experiences, support mental health, and reduce suicidality in schools that implement the program. The WWIS model is a multi-level program designed to address factors associated with increased adolescent health risk behaviors and experiences through changes to systems, practices, and environments in schools. The program works using a three-pronged approach that aims to improve health education, connect youth to the health services they need, and make school environments safer and more supportive. The program uses three strategies. 1. Providing quality health education, including sexual health education. 2. Implementing systems to increase student access to healthcare services. And 3. Creating safe and supportive environments where students feel connected to adults and peers who care about them. Research demonstrates that schools that implemented the What Works in Schools program saw reductions in multiple risk behaviors and experiences, including violence, substance use, and sexual behaviors. Schools that participated in WWIS saw decreases in sexual risk behaviors such as having 4 or more sexual partners, experiences of forced sex, absences from school due to safety concerns, and marijuana use. Now, let's look more closely at the role schools play in promoting adolescent health. In other words, how exactly are education and health connected? The social determinants of health are the conditions that shape the places where people live, learn, work, and play. They affect a wide range of health risks and outcomes. Education is one of the social determinants of health. It affects the health of children and adolescents. We also know that a child's early education and academic trajectory also affect other social determinants of health, including economic stability, access to higher education, access to healthy food, and quality of health care. For example, schools can affect the social and psychological well-being of students by reducing stress, building important social and psychological skills, and creating stronger peer relationships and social networks. Schools can affect the socioeconomic well-being of students by promoting economic stability and access to better jobs and higher earnings. Education also affects students' access to resources, including housing, living in a safe neighborhood, and access to healthy foods. Schools can influence students' health behaviors by providing them with a greater understanding of their health needs and the importance of healthy behaviors. As a result, schools can affect overall life expectancy. Research has found that by age 25, individuals who had graduated from high school can expect to live 11 to 15 years longer than those who did not complete high school. Let's look more at some of the ways schools can promote adolescent health. Schools play a vital role in ensuring adolescent health and well-being. An estimated 56 million students spend at least 6 hours a day in school during these crucial years of their development, putting schools in the position to have a great impact on the health and well-being of adolescents. To determine some ways schools can promote adolescent health, we must consider the relationship between protective factors, such as supporting mental health and providing safe and supportive school environments. Let's take some time to discuss how we think about protective factors and how these factors can affect adolescent health behaviors. What is a protective factor? In a general sense, protective factors are conditions or characteristics that promote the health and emotional well-being of adolescents. The presence of these factors typically results in positive health outcomes and decrease the likelihood of engagement with unhealthy or risky health behaviors. Risk-taking is a normal part of adolescents' development. However, adolescents tend to underestimate risks and perceive greater potential benefit from risky behavior. Ensuring the presence of protective factors, specifically in schools, can aid students' engagement in positive health behaviors, help students avoid risky health behaviors, and protect students from the potential harmful effects of negative situations. There are many kinds of adolescent protective factors at the individual and environmental levels. Some examples of protective factors at the individual level focus on positive self-worth, high self-efficacy, social and emotional competence, good decision-making, and planning and goal-setting. Environmental protective factors focus more on establishing strong and positive relationships among students, peers, and adults. Environmental protective factors include parental engagement, social support, school connectedness, and safe and caring communities that provide adolescents with support and guidance to help them navigate the difference between healthy and unhealthy risk behaviors. Many adolescents engage in risky behaviors and experiences that can result in both positive and negative health outcomes. Health risk behaviors typically begin in adolescence and can result in serious health outcomes and adversely affect adolescents and young adults. Protective factors focus on building supportive relationships with oneself, peers, and adults to engage in decisions that have healthy outcomes. Some examples of healthy behaviors include feeling connected at school, practicing safer sex behaviors, and engaging in healthy relationships with peers. In contrast, unhealthy risk behaviors include sexual behaviors that can result in HIV infection, pregnancy, and other sexually transmitted diseases, STDs. Violence perpetration, example bullying, dating violence, and substance use. Key protective factors within schools focus on healthy and supportive school environments, parent engagement, school connectedness, and community involvement. As a critical environment for adolescents, schools are in a strong position to strengthen these protective factors that these young people experience. Next, let's look at the role schools play in promoting mental health in adolescents. How do we typically think of mental health in adolescents? Mental health is a broad label that encompasses a range of mental, emotional, social, and behavioral functions. Positive mental health is associated with timely achievement in developmental milestones, healthy social and emotional development, and effective, age-appropriate self-efficacy and coping skills. In contrast, poor mental health is often a result of a disruption in any one of these areas and can be caused by external trauma or stressors as well as biological factors. Youth with poor mental health may struggle physically, academically, and emotionally. The COVID-19 pandemic amplified mental health struggles experienced by many adolescents as the number reporting poor mental health continues to climb. There are also issues of misdiagnosis, especially for Black and brown adolescents that may delay treatment and care. Mental health plays a vital role in adolescents' overall health and well-being, including into adulthood. Adolescents who experience poor mental health may experience struggles with academic performance, struggles with decision-making, increased engagement in risky health behaviors, high levels of emotional distress and substance use, suicidal thoughts and attempts, and physical violence. If you need support or know someone who is struggling with a mental health crisis, call or text 988 to chat with Lifeline, a national network of local crisis centers that provides free and confidential emotional support to those in emotional distress or in suicidal crisis. Lifeline is available 24 hours a day, 7 days a week. More information is available at 988lifeline.org. Due to the direct connection between mental and physical health, promoting mental health for all students, especially in the context of social determinants of health, is vital to promoting health equity and positive adolescent health outcomes. Unfortunately, some groups of adolescents experience poor mental health outcomes more than others. For example, data that looks specifically at lesbian, gay, bisexual, and questioning LGBTQ students, students who identify as female, and students across racial ethnic groups have reported higher experiences of mental distress. They are also more likely to have considered suicide and attempted suicide. Let's look at the data more closely. Across all racial and ethnic groups, youth reported experiencing high and worsening levels of persistent sadness or hopelessness. More specifically, in 2021, 2 out of 5 students experienced emotional distress, and reported suicide attempts increased among Black and white youth. Additionally, nearly 3 in 5 U.S. teen girls experienced persistent feelings of sadness or hopelessness in 2021, double that of boys and the highest levels reported in a decade. School environments can influence adolescents' experiences. For example, over 1 in 3 U.S. high school students experienced poor treatment based on race. LGBTQ+ youth were also substantially more likely to have experienced all forms of violence and had worse mental health outcomes than their heterosexual peers. While all teens reported increasing mental health challenges, experience of violence and suicidal thoughts and behaviors, CDC's data on LGBTQ+ students fared worse than their male or heterosexual peers in 2021. For example, more than 1 in 10 LGBTQ+ students reported they did not go to school because of safety concerns. Almost half seriously considered attempting suicide, and nearly 1 in 4 attempted suicide. To understand how students may be treated based on their race, ethnicity, gender, sexual identity, or disability, one way is to look at rates of exclusionary school discipline. Exclusionary discipline refers to practices such as suspension and expulsion that have lasting effects into adulthood and have been linked to poor adolescent mental health outcomes, decreased academic performance, and socio-emotional problems. Evidence demonstrates that students of color experience higher rates of punitive discipline in comparison to their peers. Black students account for only 15.1% of all public school students, yet represent 31.4% of in-school suspensions and 38.2% of out-of-school suspensions. Additionally, Black preschoolers are expelled at a rate more than double their enrollment. Emerging evidence also suggests that LGBTQ youth experience disparate treatment in schools that may result in exclusionary school discipline and double standards of enforcement of school policies. One study reported students who received suspensions for public displays of affection, violating gender norms, and even protecting themselves from instances of bullying or harassment at school. In this same study, school policies were enforced on some students, but not others due to non-conforming gender expressions. Additionally, students with disabilities receive 20.5% more in-school suspensions compared to students without disabilities, despite accounting for only 13.2% of all public school students. It is vital to offer safe and supportive environments for students' mental health to improve health outcomes. Previous research supports that policies and programs during childhood and adolescence improve students' mental health and improve their long-term health and functioning. School environments that promote building healthy relationships among students, peers, and adults can help mitigate negative adolescent mental health outcomes, lessen academic and health disparities, and improve overall well-being of adolescents. To support mental health, schools can engage in a variety of activities, including increasing students' mental health literacy, promoting mindfulness, promoting social, emotional, and behavioral learning, strengthening connectedness among students, staff, and families, providing psychosocial skills training and cognitive behavioral interventions, and supporting staff well-being. Now that we've discussed some of the factors that affect adolescent health and the role schools play in adolescence, let's take a closer look at what constitutes a safe and supportive school environment. When we talk about the school environment, we're broadly referring to the physical space, the people who interact and engage in this space, and the structural policies and practices that are in place. Schools play a vital role in communities by providing safe and supportive environments for students and their families. In addition to providing education, they also give adolescent students the opportunity to engage in academic, physical, and social activities. We recognize that schools face extensive pressures and challenges that were magnified during the COVID-19 pandemic and continue even now. Therefore, as we look for opportunities to provide support to the entire school community, we want to be strategic so that we don't overextend already stretched resources and staff. Additionally, and not surprisingly, school environments have a large impact on student outcomes and are critical places for shaping students' physical, psychological, and social development. Positive school environments can have a meaningful influence on student outcomes, whereas poor school environments are strongly linked to poor test scores, low graduation rates, low attendance rates, and student disengagement. In safe environments, students feel supported and cared for, and they have a sense of belonging. Moreover, students who experience safe and supportive school environments are less likely to engage in risky sexual, violent, or substance use behavior. Let's take a deeper look into how schools can be safe and supportive environments for students. We briefly touched on the important role schools play in promoting protective factors that encourage healthy behaviors among adolescents. A safe and supportive school environment is a result of a collective effort among schools, families, and communities. Activities, policies, and programs of a safe and supportive environment promote student engagement among their peers and feelings of connectedness to important adults in their lives at school and home. 3 key protective factors help promote safe and supportive environments for youth. First is school connectedness. This refers to students feeling that adults and peers in their schools care about their learning and about them as individuals. We'll look at this more closely later in the presentation. Second is parental monitoring. Parents who make a habit of knowing about their teens, what they are doing, who they are with, where they are, and set clear expectations for behavior with regular check-ins, can reduce their teens' risk for injury, pregnancy and drug, alcohol, and cigarette use. And third is parent-adolescent communication. Positive communication between parents and adolescents has a meaningful impact on adolescent health behavior. When parents and adolescents have open and honest communication about relationships, sex, STD prevention, and pregnancy, it is less likely that adolescents will engage in behaviors that place them at risk for these conditions. Safe and supportive environments can be particularly helpful for lesbian, gay, bisexual, transgender, and questioning LGBTQ youth, who are more likely to be bullied at school and may lack family support at home. This holds true, too, for students of other communities experiencing health disparities, such as students who are Black, Indigenous, or people of color, BIPOC, those who have disabilities, and those who experience financial hardship. Before moving on to the next section, let's pause for a quick knowledge check. True or false? School connectedness is a protective factor involved in ensuring safe and supportive school environments. If you answered true, you're correct. Remember that school connectedness is a protective factor involved in ensuring safe and supportive school environments that connect adolescents to a network of caring peers and adults, including parents, other primary caregivers, and teachers. We talked briefly about school connectedness earlier in the presentation, but how do we define school connectedness? School connectedness means that students feel a sense of belonging to and supported by their school environment through establishing connections with their peers and school faculty and peers who they feel care about them. Connecting students to adults and peers they believe care about them is an important protective factor. It can reduce students' likelihood of engaging in risky health behaviors, experiencing mental health issues, keeping them from committing or being victims of violence, and other behaviors associated with sexual risk and poor academic outcomes. Currently, about 2 in 3 high school students report feeling connected to others at school. Students who report feelings of school connectedness are more likely to have positive educational, behavioral, and health outcomes in adolescence and into adulthood. Understanding students' perception of school connectedness can help schools identify ways to improve school environments and promote factors that protect against unhealthy health behaviors. School connectedness has been linked to several positive academic, psychological, and physical outcomes among youth. For example, students who feel connected at school experience improved positive outcomes, like increased academic achievement, attendance, and graduation rates, increased likelihood of bystander intervention during bullying and seeking assistance after being bullied, improved health outcomes. For example, a 2019 study found that school connectedness in adolescents was a protective factor for healthy behavior and well-being in adulthood. This study suggested that school connectedness experienced during adolescence may have long-lasting protective effects on adulthood well-being. Students who feel connected at school also experience decreased negative outcomes like these: decreased likelihood of engaging in sexual health risk behavior, such as having unprotected sex, decreased mental health issues, and decreased experiences of violence and substance use. School connectedness is beneficial to all students, but unfortunately, not all students experience it. In the promotion of school connectedness, it's important to consider 1. Strategies that center working to reduce health and education disparities, and 2. Strategies that are reflective of the experiences of all students. As part of these strategies, efforts that acknowledge the diverse experiences and perspectives of student and faculty and encourage school connectedness could include the establishment of student-led organizations in schools to support youth, professional development training for educators on classroom management and inclusiveness, as well as the establishment of youth development programs. Whatever approach schools take, it is important to apply an intersectional lens that considers the processes, practices, policies, and structures students experience. This requires identifying the individual, social, environmental, and structural factors that are barriers to fostering a safe and supportive school environment for all students, no matter their background. Now, let's examine strategies schools can implement to promote protective factors in a safe and supportive school environment. Promotion of safe and supportive schools focuses on 3 key elements. First, strengthening school staff capacity. By providing teachers and support staff with professional development on classroom management techniques, schools can increase school connectedness and improve academic-related outcomes. Additionally, providing professional development that focuses on supporting LGBTQ+ adolescents can improve school connectedness for LGBTQ+ youth who often experience higher levels of school violence and lower levels of school connectedness. Second, increasing student access to programs and services. This may include implementing youth programs that promote development and connection, such as mentorship and service learning programs. It could also include establishing or enhancing student-led clubs that support LGBTQ+ youth. Or it might include establishing youth advisory councils. These kinds of programs and services can help strengthen adolescents' sense of identity and self-efficacy in making healthy decisions. And third, the element of promoting safe and supportive school environments involves engaging parent and community partners. Schools can share information and resources with parents or other primary caregivers about positive parenting practices. This could include how to talk with adolescents, especially about sex and other risky behaviors. Before we move to the next section, let's do a quick knowledge check. Which of the following outcomes is school connectedness linked to? A. Improved mental health outcomes. B. Improved sexual health outcomes. C. Better academic outcomes. D. Reduced substance use. Or E. All of the above. As you reflect on this question, feel free to hit pause on the training and take a quick stretch break. If you picked E. All of the above, you're correct. School connectedness is linked to A. Improved mental health outcomes, B. Improved sexual health outcomes, C. Better academic outcomes, and D. Reduced substance abuse. Let's now look at the role of school policies and practices that affect adolescent physical and mental health and well-being, including how connected students feel at school. First, what exactly do we mean by health-promoting policies and practices? As the name suggests, policies and practices that promote students' physical and mental health are what we call health-promoting policies and practices. They achieve this in several ways: reducing the use of exclusionary discipline, which disproportionately affects students of color, students with disabilities, and students who identify as LGBTQ+, ensuring policies are implemented and enforced equitably, and supporting the physical and mental health of staff and students. We'll look at some examples shortly, but first, what are the benefits of health-promoting policies and practices within schools? They can reduce disparities, including both disciplinary and educational disparities, especially for students of color, students who identify as LGBTQ+, and students with disabilities. Increase school connectedness, improve students' physical and mental health, foster safe and supportive school environments, and improve academic outcomes. There are many kinds of health-promoting policies and practices that schools can implement. For example, schools can implement policies and practices that promote school connectedness among adolescents, particularly among LGBTQ+ adolescents. These may include classroom management strategies, which entail incorporating positive behavior management strategies, such as social-emotional learning and positive behavioral interventions, to build connectedness among students, teachers, and other educational staff. Inclusive practices and policies. These are school practices and policies that promote inclusivity and a sense of belonging, especially for students who are members of BIPOC or LGBTQ+, immigrant, or from other marginalized communities. Positive youth development programs that focus on strengthening adolescents' sense of identity, belief in their ability to achieve future goals, self-regulation, and self-efficacy, as well as their physical, emotional, and social competencies. The enumeration of anti-bullying policies, which reduce the likelihood of bullying in schools. Let's dive a little deeper into each. First, let's talk about classroom management as one strategy to promote school connectedness. As a reminder, classroom management is defined as the process teachers and schools use to create classroom environments. This includes teacher and student-led actions to support academic and social-emotional learning among all students. CDC researchers have identified several classroom management approaches that promote student connectedness and engagement, including behavioral management. Teachers provide clear and consistent expectations for behavior in the classroom and take actions to promote positive, pro-social behaviors. When these actions occur, students report a stronger sense of connectedness to school and their peers. Teacher caring and support. This refers to students who believe their teachers care about them and build strong and positive relationships with them. These skills help build caring and supportive relationships between students and educators, thus higher levels of student connectedness to school and their peers. In addition, teacher caring and support have been associated with improved student engagement in math and reading. Building strong, supportive, trusting relationships with students may be particularly critical for students who are experiencing uncertainty or trauma, for example, from racial injustice and marginalization. Teacher expectations. Students who believe that their teachers have high expectations for them are likely to be more engaged in school and report higher levels of school belonging. Peer connection and support. This means that students feel connected to, supported by, and respected by their peers. Students who report this demonstrate higher levels of engagement in school and feel more connected to their school. Management of classroom social dynamics. When teachers actively engage in managing social dynamics and promote positive interactions and friendships in class, students report feeling more connected to their peers, higher levels of school bonding, and a sense of belonging at school. And finally, student autonomy and empowerment. When students feel their teachers are open to their ideas and allow them to make choices regarding their learning and schoolwork, students are more engaged in school. They are also less disruptive in class and report feeling a stronger sense of belonging and connectedness to their school. Next, let's look at LGBTQ+ practices and policies as a strategy to promote school connectedness and improved outcomes for all students. Schools can help address the adolescent mental health crisis by implementing policies and practices that support LGBTQ+ youth. Individual teachers within the classroom or throughout the entire school community can implement these policies and practices. LGBTQ+ supportive policies and practices positively affect the school's environment, making a safer and more supportive space for all students. One example of LGBTQ+ policies and practices is providing professional development on inclusivity, providing resources and information for teachers and other school staff on how to support LGBTQ+ youth has been shown to improve school safety and connectedness in schools for both LGBTQ+ youth and their cisgender, heterosexual peers. CDC's resource, Creating Safe Schools for LGBTQ+ Youth, Core Competencies for Professional Development, includes learning objectives that schools and school districts can incorporate in their professional development programs to help teachers and other school staff to build support for LGBTQ+ youth in schools. Another example is identifying safe spaces. Many LGBTQ+ students feel unsafe at school, which can lead to poor academic and mental health outcomes. Creating spaces that allow students, parents, and faculty to engage in authentic and trusting conversations that promote school connectedness can help students feel safe. Research has demonstrated that knowing that supportive educators, allies, and specific spaces are available makes LGBTQ+ students feel safer at school, skip fewer classes, and earn higher grades than students without supportive educators. Schools can also implement anti-harassment policies to clearly define the school's anti-bullying and anti-harassment policies and procedures. These kinds of policies have the potential to prevent bullying and ensure that all students feel safe. Finally, schools can establish gender and sexuality alliances, GSAs. Research has demonstrated that the presence of GSAs has been associated with improvements in school safety and school connectedness. GSAs can also increase students' sense of purpose, self-esteem, and agency, thus decreasing the likelihood that students will engage in risky behavior and have poor mental health outcomes. Research demonstrates that schools that have implemented LGBTQ+ policies and practices have had positive effects on health behaviors and outcomes for both LGBTQ+ and heterosexual students. For example, students are less likely to experience violence and harassment and suicidal behaviors. Now, let's look at positive youth development programs. Positive Youth Development (PYD) programs promote school connectedness by providing youth with networks of supportive adults and opportunities to engage with each other. These programs aim to develop and enhance positive characteristics of individuals and their surrounding context. Schools and local education agencies can implement PYD programs in schools or connect students to programs in the community through linkage and referral programs. Examples of PYD programs are youth advisory councils, which allow youth and adults to make decisions together, mentoring programs, and school community partnerships. For more information on PYD and examples of successful PYD programs, visit youth.gov/youth-topics/positive-youth-development. Enumeration of anti-bullying policies is another example of a health-promoting policy. First, let's discuss what we mean by enumeration. Anti-bullying and harassment policies at the state and local levels are common for anti-bullying initiatives and prevention efforts. Enumeration of these policies refers to explicitly identifying specific traits or characteristics of students that could be the basis of bullying, such as race, disability, sex or gender, national origin, sexual orientation, ethnicity, and gender identity or expression. These policies specifically identify groups of students who have historically been targets of bullying. The U.S. Department of Education lists enumeration as one of the key components in establishing robust anti-bullying policies within schools. Enumeration of anti-bullying policies is an example of a health-promoting policy. These policies can decrease student experiences of bullying and better health outcomes for LGBT youth, foster greater school safety, reduce victimization based on race, sexual orientation, and gender expression, lessen social aggression, and decrease the likelihood of suicide. One study found that sexual minority youth aged 13 to 21 years experienced lower levels of bullying victimization in schools with policies that enumerate sexual orientation. Another study using student-level data from the National School Climate Survey that looked at LGBT students found that districts with enumerated policies reported greater school safety, less victimization based on sexual orientation and gender expression, and less social aggression than students in districts with generic policies or no unidentified policies. How do schools implement enumerated anti-bullying policies? First, schools should review any state requirements and regulations regarding enumerated anti-bullying and harassment laws. If there are such state requirements, schools should ensure policies align with state requirements. Once schools have implemented enumerated anti-bullying policies, they should clarify that all students are protected under the policy, revisit the enumerated characteristics often, as students who are more likely to be the target of bullying may change over time, and provide an explanation of why some groups of students are more likely to experience bullying. Before we move to our final section of today's training, let's do a quick knowledge check. First is a true or false question. School policies and practices can be a tool used to promote adolescent well-being. True or false? If you answered true, you're correct. School policies can be a positive tool to promoting adolescent well-being. Let's do a multiple choice question. How can health-promoting policies and practices improve schools? They can A. Improve school connectedness, B. Support safe and supportive schools, C. Reduce health disparities, D. A. Improve school connectedness, and C. Reduce health disparities, or E. All of the above. If you picked E. All of the above, you are correct. Health-promoting policies and practices improve school connectedness, support safe and supportive schools, and reduce health disparities. We've spent most of our time discussing high-level concepts around student health, and you may be wondering how schools can better support adolescents' physical and mental health and well-being. We'll start by acknowledging that school staff face extensive responsibilities and challenges. Even with those realities, there are many steps schools can take to improve the experiences of students, educators, parents, and other school staff. For example, working to understand the school environment, reviewing and, as appropriate, revising school policies and practices, implementing an evidence-based school health program, and encouraging broad understanding and equitable implementation of policies and practices. A school community is reflective of the demographic makeup of the school population, including students and school staff. To understand the full school community and gain a sense of the diversity and experiences of the students who attend and the staff who work at the school, schools may wish to assess their history, geographic location, student demographics, and languages spoken. Look at student engagement, student safety, perceived and actual, and the learning environment. Assess what assets, challenges, and opportunities there may be for improving the experiences of students, staff, and their families within the school. As part of this process, schools may often collaborate with students, faculty, administration, parents, and the broader community. If there are opportunities to improve school outcomes, school leadership may strengthen existing collaborations or develop new collaborative approaches. Then, together with their partners, schools may review the school's policies, programs, practices, and efforts to ensure they are reflective of the needs and beliefs of those who attend the school. As part of this review, they may identify how existing policies, practices, and procedures may be affecting students. They may also identify if and how these policies, practices, and procedures may affect more groups of students than others. After completing this review, schools may decide to identify policies and practices that emphasize developing, repairing, and sustaining strong relationships among students, faculty, parents, and the broader community, explore the benefits of health promoting policies and practices, and train school staff on inclusive policies and practices that support all youth, including students within their community who may be experiencing disparities, such as LGBTQ youth, BIPOC students, or students with disabilities. Schools may prioritize resources to policies, programs, and practices that promote school connectedness and improve adolescent physical and mental well-being. Schools may support the implementation of evidence-based school health programs, such as the What Works in Schools program or community mentorship programs that strengthen young people's sense of identity, belief in the future, self-regulation, and self-efficacy, as well as their social, emotional, cognitive, and behavioral competence. Positive youth development programs serve as protective factors in reducing sexual risky behaviors, prevention of substance use and violent behaviors, improvement of academic performance, and decreased likelihood of unintended pregnancy. Positive youth programs promote connection among peers, adults, and the greater community. Examples of positive youth development programs include mentorship programs and service learning programs, and then working to connect students to these types of programs in their communities. Affinity groups and student alliances, such as gay-straight alliances or genders and sexualities alliances, are also linked to positive youth development, improvements in school safety, and a sense of belonging, purpose, and agency among adolescents. Schools and education agencies often create a plan for establishing and strengthening student affinity groups. As part of this, having a diverse workforce allows faculty more opportunities for engagement and the ability to establish connectedness with students who share similar experiences or beliefs. Students, families, and community members often want clear and detailed information about school policies and procedures, where they can find these policies and procedures, and how these policies and procedures will be equitably implemented. Research has also found that information sharing to improve parent and family knowledge, making families feel welcome and a part of school communities, and building infrastructure, systems, and educator capacity to improve family engagement is associated with improved social, emotional, and academic outcomes. Schools often collaborate with students, faculty, parents, and even occasionally with the greater community when implementing school policies and practices to ensure broad understanding of policies and practices. In sum, it can be beneficial to strengthen the community's understanding of the school's rules, expectations, and potential disciplinary actions to ensure fair and consistent application and community buy-in for any existing or new policies and practices. As a recap, there are many steps schools can take to improve the experiences of students, educators, parents, and other school staff, including working to understand the school environment, reviewing school policies and practices, implementing evidence-based school health programs, and encouraging broad and equitable understanding and implementation of policies and practices. This training was made possible in part by a cooperative agreement with the CDC. The views expressed in the training do not represent the official policies of the Department of Health and Human Services. We would like to acknowledge and thank Change Lab Solutions staff who contributed to this training. Content was developed by Tyra Satchel with the support of Melanie Tianson, Sabrina Adler, Alexis Eto, and Holly Story. Development was overseen by Rebecca Johnson. Editing and production management was supported by Chelsea Wu. This takes us to the end of our presentation. Once again, thank you for taking the time to join us for this session. To recap what we covered: what factors affect adolescents' social, emotional, and physical outcomes? What role do schools play in promoting adolescent health? What effect do school policies have on adolescent health and well-being? How can schools better support adolescents' physical and mental health and well-being? Thank you.